My name is Debra Danforth, and I'm a nurse practitioner. I work for Florida State University College of Medicine, and my current position is the director of the Clinical Skills and Simulation Center, and I'm an associate professor there. I started out in nursing. I started out 15 years ago at University of South Florida with just a static mannequin that taught how to do CPR, and actually would do a scenario and say, okay, go push button number 1 or 2 so that I could have abnormal heart sounds. So basically started out with a mannequin and then took other task trainers to make it, and have moved up to Tallahassee, worked in nursing up in Tallahassee, and then the last 6 years I've been at the med school, we only had standardized patients. So I actually have worked with standardized patients. And since 2008, I actually got to start from the ground up. Had a shell, got to design the entire center, put in rooms, put in simulation, purchase the mannequins, compare mannequins left and right. And the latest thing is we're actually, since we have 6 regional campuses at Florida State, I actually go on the road and pack up a bus with stimulators and standardized patients and go to the 6 regional campuses and do it in, like when they say they come back to the center, they always say, oh, it's a testing. But if we were in our own place where we're used to practicing every day, so we actually go in and set up rooms, 3 rooms actually, with different scenarios with either a standardized patient or a simulator, and have cameras that we can observe what's going on in the room on the outside, so the students do not even know we're in there, so they're actually going in. So going from the static mannequin to now actually having a complete mannequin. I actually spoke on blended learning during this conference, and it probably is because that I don't just use simulators as simulators, that I have a standardized patient. So I use and to me they're part of simulations. So if I wanted a patient to have an abnormal heart sound, you can't give 4 SPs the same murmur, but I could give Harvey 4 murmurs, or I could give SimMan 3G 4 murmurs, because I can actually program them that way. So what I do is have them actually interview a standardized patient so that we can see the interaction with the patient and see how they talk with each other. And then it would say, now when you're doing the exam, go to the Harvey or to this whatever simulator I decide to use, and then they can go over there, do the exam, but I can also check competencies. Do they know how to put the stethoscope in the second right intercostal space, in the second left intercostal space? So I'm listening to aortic or pulmonic. And when they get to the mitral area, can they tell me, oh, they got a mitral regurg? Okay, then go back to the patient and say, okay, I heard this abnormal heart sound. I like to do an EKG. I like to do an echocardiogram, and actually refer them. And so then we can see how the students are actually critically thinking, and then we're also checking our competencies. Well, I've been going to Suns for many years, and so the advantages to Sun, networking is a big important thing. So even though you call me an advanced user, well, I'm still a beginner because I can always learn from my colleagues. And pediatrics is not my background. So like I said, I'm a nurse practitioner, but I'm adult. So going to sessions at the Sun, I can learn how other expert pediatricians or pediatric or neonatal or infants, how they're using them, so that I can bring it back to the program, because it's not my expertise. I may have expert faculty, but they don't know simulations. So just networking with them. For being a new person, you need to connect and find a mentor. Didn't have the mentors back then. Friends I've grown up with through the years now actually have theories, or almost theories out is what they're looking at. So we've known each other from the past, but network, know each other when you see them, see what they're doing, see if they're doing anything innovative, see if you can work collaboratively together. So they may be doing the same thing you are, and it's okay to do it from here to California or wherever. I think this is a great initiative for new and experienced educators, hospital, and you get to see all the different aspects because it's not only nursing, it's medicine, respiratory, EMS. So it's a great place to come to learn wonderful, how I say it, it energizes you because when you come here, you go back and you're like, oh, we want to try this, you want to try that, you want to try this. And everybody here is excited about it, so you feel comfortable. And you know that once you leave, yeah, you collected some cards, use them. Don't just collect those cards and never worry about them again. Actually use them and contact them and keep in contact. Or when you're up in their area, hey, I'm here. Can I stop by and check out your lab? And I always tell anybody that's in Tallahassee, you're welcome to come see the center anytime.